First, we have Dr. Foreman. Please welcome her to the stage.
I'm going to put this here. Well, welcome to Houston. Oh, you can do better than that. It is indeed my pleasure to welcome you to our great city, Houston. And Houston is indeed proud to be the first city to host the Cities Changing Diabetes Global Summit outside of Denmark. So again, we're excited that you're here, and we want to give you that Texas-sized welcome. As our mayor already shared, we are a very resilient community. And just like our friends from Mexico City, who also experienced a devastating natural disaster, we are indeed Houston strong, and we are recovering. Now, it's during a natural or man-made disaster when we realize how very important community is. These are the people we lean on in our family, in our neighborhood, in our place of work, at school, and in our house of faith. People that we may be different from, but that we have something very powerful in common with. In my Cities Changing Diabetes community, I am surrounded by very diverse leaders who are passionate about disease prevention and health promotion, just like I am. They are executives from private sector companies, faith leaders, members of small nonprofits, leaders from patient organizations, government employees, and regular people just very interested in the topic of diabetes prevention. When we started Cities Changing Diabetes 3 years ago, I thought that I had participated in public-private partnerships before, but they were completely different from what I've experienced through Cities Changing Diabetes. A public-private partnership is typically led by one entity, government or private, who sets the agenda and gets the other players to do what it sees as important. That is not a true partnership. That is not an equal partnership. In Houston, we achieved an equal partnership from the beginning. We were fortunate to collaborate very closely with my former professor from the University of Texas School of Public Health, Dr. Stephen Linder, who identified 4 major risk profiles for vulnerability to diabetes in Houston and Harris County. They cut across ethnic and racial backgrounds and geographic locations. Vulnerability to diabetes is impacted by social and cultural risk factors that the public health and medical community should consider when developing new interventions to address the disease. This was indeed an aha moment for me and allowed me to think differently about who the target audience for the Houston Health Department should be. We now have a new understanding of how everyone in our community is vulnerable to diabetes. While Dr. Linder's research was being prepared in the Houston mapping phase, we had 11 roundtables with over 200 participants, spoke with over 100 people with diabetes, and held numerous one-on-one meetings in the community. We met over 125 patients and healthcare providers at the American Diabetes Association Expo who were asked how Houston should stem the diabetes epidemic. The roundtables, meetings with patients and providers, and individual stakeholder one-on-one meetings informed us that the diabetes epidemic is a big concern to all stakeholders, but they are unsure of how to address it and very unsure how to do it collaboratively. Health literacy is a very common concern among all Houstonians. Solving the diabetes epidemic is a challenge for all stakeholders in Houston, not just hospitals, clinics, and public health. Awareness about the disease is a challenge for patients and caregivers. Resources are difficult to find, and more often than not, national websites are confusing with too much information. And coordination and collaboration among all stakeholders can always be improved. We boiled down Dr. Linder's research, along with the other research with our community stakeholders, to 5 major themes. We were confident that these themes were important as they emerged from multiple sources, whether it be qualitative or quantitative research, and they were affirmed by the stakeholder conversations. We didn't exactly know what the intervention should look like, and there was no playbook from Novo Nordisk. There was no roadmap to follow of particular policies or interventions to pursue. There was no urban diabetes toolbox back then. It all culminated with a Shark Tank-like session in February 2016, where each action work group presented their best ideas and solutions to the diabetes epidemic in Houston. It was an incredibly energizing process, confusing and chaotic at times, but it brought about the famous competitive can-do spirit here in Houston. Each action work group wanted their solution to be the best and ultimately get selected. They went to work, some of them meeting multiple times a week, even at night and in the evenings. The action work group is where the real work of Cities Changing Diabetes is moving forward. The Houston Diabetes Resource Center, known as the HDRC, is a one-stop shop virtual community that connects patients, providers, and employers with educational resources, programs in the community, and navigation services. With seed money from Novo Nordisk, Gateway to Care, a nonprofit organization here in Houston, convened stakeholders to get their input on the development of the HDRC. The HDRC was inspired, actually, by the Kentucky Diabetes Network, which serves as an important information hub for anything diabetes in the state of Kentucky. If the good people of Kentucky could do this, certainly Houston could develop its own site. But we added important features inspired by our vulnerability research. It told us that people, regardless of insurance status and background, are vulnerable to developing diabetes and have a very hard time navigating an increasingly fragmented healthcare system. This is why Gateway to Care was selected. It's an organization that trains and employs state of Texas certified community health workers. For the HDRC, the Gateway to Care community health workers received an AADE paraprofessional training to better help with patient navigation and referral to community resources specific to diabetes. And after much hard work, I'm proud to say that the HDRC site launched this week. And our congregational health leadership training launches January 19th of 2018. Our virtual peer support program will launch next month. How did we get here? The road to success is not linear. We learned to appreciate the process and appreciate our partners who were going through challenging times that impacted their commitment and involvement in Cities Changing Diabetes. 3 years is a very long time. Organizations merge, close, strong leaders leave, and new ones join. So, to sum it up, what's the secret sauce behind Cities Changing Diabetes Houston's success? First, we pursued multi-sector representation from the beginning. We invested a lot of time in understanding the complexity of Houston. We deliberately sought out organizations that do not often collaborate, but have a lot to contribute when they do. We were focused on Cities Changing Diabetes Houston's initiatives that would prevent diabetes for people not diagnosed, but more importantly, make life a lot better for people already diagnosed with the disease. We were constantly exploring what national and international models were useful, and we didn't just copy them or adapt them to Houston. We tried to update them and make them better. Finally, We had a completely grassroots-driven process where Novo Nordisk allowed the Houston stakeholders to translate the research, propose solutions, and decide how best Houston should collaborate around implementation of the interventions. Again, a true public-private partnership with an emphasis on partnership. Thank you.